I want to echo Senator Collins' comment and her thanks and appreciation. I share that. I know that there is plenty to argue and quibble about and whether or not communication has been clear or not clear. I think we do owe that to the American public. But I also know that the work that you and those that are part of your team is hard, arduous work, and you have definitely been put to the task. So I appreciate the work that you do. I want to direct my questions to you, Dr. Redfield, and first, thank you for CDC's effort to help our state and local public health departments. Recently, we had a CDC team deployed to Anchorage to assist us there with an outbreak of COVID that we had seen within our homeless population. And you were quick when asked, and we greatly appreciate that assistance. I want to ask you about the interim guidance, the interim guidelines that states are considering as they're drafting these plans to be submitted for mid-October. And it goes to Senator Kane's comments about the communication and the need for additional clarity that I'm hearing from my state, specifically in the allocation, the first allocation of the vaccine in terms of the jurisdictions and who is to receive that. It's states, but for instance, the tribal health system, is that its own jurisdiction for purposes of allocation? When we talk about critical populations, it's my understanding that the first phase is going to be allocated based on targeting these critical populations. Well, in Alaska, we've got about 1/4 of our population Alaska Native that could be determined to be 18%, determined to be critical population, and then further to additional guidance on what qualifies as a healthcare worker. In our state, our community health aides are some of those frontline workers. Can you help me with further clarification for purposes of the state's plan on guidance with allocation and defining critical populations?
Thank you, Senator. Obviously, critical questions. I will say at this moment in time, the definitive answers in terms of the allocation process have not been completed. I do take Senator Kane's and your comments to heart, how important it is that when that is completed, that it's communicated in an effective way, that we are currently going to see the plans, as you know, from each of the states, how they would propose to allocate. The prioritization of how this vaccine will be distributed will depend on which vaccine and what the data says, but that decision, ultimately, the recommendation will be the Advisory Committee of Immunization Practices that will give that recommendation once they know what vaccine they're recommending it for. But I will reiterate the comments from this hearing back to Operation Warp Speed as that allocation decision is made, that it's communicated effectively.
And that allocation decision, can you confirm that it is the CDC that is responsible for determining that allocation?
The allocation the decision will be made by the Operation Warp Speed is what I would believe. What will happen, though, is that the ACIP, which is an advisory group to me as the director of CDC, will recommend the prioritization of who should be vaccinated. As you said, should it first be all the individuals that are vulnerable in nursing homes? Should it be healthcare workers? If so, what kind of healthcare workers? Should it be Native Americans, African Americans, Hispanics at greater risk?
So,
I can't
Dr.
get ahead of
Redfield,
the
let me
ACIP.
interrupt to ask just one more question of you here. I've got the direction that you're going with the definitions there in terms of critical workers. We've talked before about the public health IT infrastructure. Yes. I think we recognize that certainly in a state like mine, it's been pretty tough when you're faxing, literally faxing the results of your COVID tests, and it's not just Alaska, it's the state of California, it's a mess out there. what is the administration's plan to ensure that states have the support that they need for the requirements on reporting for this new vaccine? Because we're concerned in our state that we're not prepared for the level of reporting that will be required. Right. We don't mind the reporting, but we do not have the infrastructure, if you will, right now on the health IT side.
Yeah, that's going to be a very important part of the plan that each of the state's jurisdictions of the 64 make. In addition, there is plans within the Operation Warp Speed to augment IT capacity where there are gaps. But again, in order to see that, we're going to see the state's plans. I did release $200 million today for the states to begin to develop those plans and really identify those gaps that they have, so then hopefully there'll be further resources to begin to fill those gaps. Because it is going to be very important that we do have the reporting for the monitoring and safety of these vaccines, as well as to make sure that we can distribute this vaccine in an effective way, equitably, to the American public.
Thank you, Senator Murkowski.